My name is Dr. Sheena Miller. I am the Graduate Clinical Placement Coordinator. Some of you may already know me. We may have already worked together in your MSN program. What I understand is that you all have completed your MSN, and these are MSN to DNP students. Am I correct there? Yes. All right. Wonderful. So what you guys will be doing is you will be doing your project courses, which is 6801, 02, 03, and 04. And you all may have already started to think about what you want to do for your DNP project. And so for the DNP project courses, they're going to be a bit more specific on maybe you may choose somewhere that you currently are working because you may have already identified a problem that you want to apply your project to, or you may have an area, been in contact with some of your clinicals that you did in your MSN. So for this, I thought that maybe we may just individually kind of like if whoever wants to start, we can kind of talk about what your idea is, and then we can kind of bounce off some clinical ideas for it if anybody has any. The only thing I want to say is that sometimes students do their clinicals or their DNP projects in universities. And if any of you have done this, worked in a university prior, you know that those clinical affiliation agreements, which you do need for your project courses, can take a while. So that'll be something that we want to make sure that we jump on prior. I've honestly seen some university clinical affiliation agreements take up to half of a year. And that's not on ETSU stalling or anything. That's because the universities often need to go through many different hands. They need to go up the chain, looked over, their legal needs to review it. So it can take a long time. So the sooner we can get those affiliation agreements started for you, the better that we have to get you to be able to start your project courses right away, be able to get in there and do any of those hours that you need to do for the project. And so that will be my goal. And the good thing is that most of us are standing clinical affiliation agreements are 5 years. So they should cover you throughout the remainder of your program. So even if we talked about it and started on it today, it would cover you throughout. Every so often, some places do have specific ones, but for the main general ideas, usually they're 5 years. Some of the bigger companies, such as like Ballot House, sometimes they'll push them out for 10 years. They'll do those agreements for 10 years because they work with us so much. So who wants to start with what their plans are for what they're thinking about for their project? Don't be shy. There's only a handful of us here anyways.
Go ahead. Shannon. Go ahead, Shannon.
Okay.
Hey, Shannon.
Hi. So the kind of the feel for my project is like a community action project.
Okay.
I, having experience in leading through the pandemic in the acute care, I really found a passion for the kind of the PTSD that the healthcare workers are suffering now.
Yes.
And so one thing that I really want to do is start a community group where in my area, the local healthcare workers, and that's not just nurses, it's anybody through the pandemic who, even the kitchen staff, the housekeeping staff who worked so hard during the pandemic are really still struggling with some PTSD and mental health issues post-pandemic. So trying to start a community access group where we can have, meetings, monthly meetings or bi-monthly meetings for anybody that, is still struggling.
Yes.
And kind of have a safe place to share.
Yeah.
So kind of on the lines, thinking of how NA and AA gather in a safe space, something like that, where they're out of their hospital, where they're in a safe place in the community where nobody is judging them. Their leadership are not there. And I have several of my friends that are mental health nurse practitioners that have agreed to kind of act as, like one of my fears is someone comes in and they're in actual crisis at that moment. So having resources available if someone is in immediate danger or in immediate crisis, but just having a safe place where they can kind of fellowship and talk about their experiences and know that they're not alone, so that someone actually is doing something to show, hey, we care about your mental health and we care about what you went through, and it was real and it was important. And now let's try to figure out how to move forward from this space.
So I think that is an amazing idea. I think it's almost like Healthcare Anonymous. It's not, it's just silly, but something very similar to that. One of the things I found when I was teaching mental health and when our clinicals, we always we did NA meetings and AA meetings in person. And then when the pandemic happened, we ended up having to go, a lot of those went virtual, which was a great option. Some places were still offering both. They could go virtual, they could go on ground, and it opened up a whole new pathway that you were seeing people in Colorado, you were seeing people in Florida, you were all coming together. So it wasn't just that one section or that one community. So one thing I want you to think about is, this is a fantastic idea, and I think that you can expand it even further. But the biggest thing I'll say to you is, you could bite off too much, right? So I would think about, where would be a good place to start, like such as maybe it might be that you choose one medical center and that's who you speak with and that's who you start with, and you start with those individuals. And I'm just going to make up where I live, so I'm just going to use Fort Sanders, in downtown Knoxville, that you went there and you worked with that hospital and you started there. Mm-hmm. And then you can expand out as you go on, because I think one of the big things is that's a powerful idea, and I think it's wonderful, and I think it's very much needed. But one of the main goals is for the DNP project is to get done, right? And to get all the information, because you only have a small period of time, even though it seems gigantic, right? Right now you're looking down the barrel and you say, oh, I feel like I'm going to be doing it forever. That time blinks by, as we all know, because you've gone through enough nursing school to know that the days are long and the time is short, and there you are. So that's what would be my suggestion, is to start in one location and then know that you can expand out. And you might want to try to start in somewhere that it may be somewhere that you've worked with, it may be some of these connections that you have, some of these providers that may be referralists. So you may want to kind of work maybe in one of the areas that their population is, if they're a provider that's inpatient and they do rounds, or if they're an outpatient and they refer their patients to a certain area. So that may be something. And I think that it's great to open up to all individuals, whether it be if you're working in the kitchen, security, if you're working in the emergency room, or if you're working in the long-term care. I think that that's really great to open it up to all those floors and all those individuals, because the pandemic didn't just affect one group of people. And it's still very evident. And I know that I think about things all the time, how media, chews on something, they get something new to chew on, and then we kind of all forget about it. And I was just thinking about my own stuff. I was thinking about, a war that was going on elsewhere. And I thought, I haven't heard a lot about it. Well, it's got to still be going on, but no one's just talking about it. So they got something else to chew on. So it's still there. And I think it's still very real. One of the things that I remember from my own self when I was doing my project is we just hit the ending of the pandemic, or the beginning of it. It was like a transitional piece. And that gave me the heads up that, some of the statistical data that you would receive will be altered compared to if you are doing this 10 years from now. Some of these nurses are they're going to be maybe 10 years old when this happened, and they and they were in second grade, or fourth grade. 10. I'm trying to think of what grade you are in, but so I think that that's really great. So when you're thinking about right now, are you thinking about any specific area, if you thought about narrowing it down?
Yeah, so during the pandemic, I was the director of nursing at Morristown Hamblin. Okay. And my friend Lisa Kelly, who is the CNO there now, is a very good friend of mine. So working, with her, and of course, getting her permission to, a lot of the staff that are there are the nurses that were nurses that I was in charge of during the pandemic. So, and, even before I even applied for this is something Nancy and I were talking about this. This is something that I've been passionate about and wanting to do for years now. So, I mean, I know it hasn't been that long since the pandemic, but it's something, you know, I had 4 nurses who called me in the middle of the night ready to commit suicide during the pandemic. So it's, even though it's been a little bit while, it's still very fresh. And I just don't think we did a very good job letting them know that they mattered and their mental health mattered. And I really want everybody to know that we do care about your mental health, and we're here to listen and kind of, you know, commiserate with you.
Yes.
So working there at that local hospital, you know, it's a smaller hospital, and it's my community where I live and where I've served since I've been here. So that's where I plan to, you know, concentrate my efforts in our small community in Hamlin County.
So the great thing is, yes.
Sheena, this is Nancy. One thing, because like Dr. Miller said, this is a huge bite and we don't have a lot of time.
Right.
So if you could go ahead and start digging, I know there's tons of information from the pandemic about healthcare workers and their mental health, and maybe some actions that others have done. What have other places implemented to address this? And see what you can find there. It may be that you can replicate or fine tune what somebody else has done to meet the needs in your community. And one that would save you a tremendous amount of time. It might be able to for you to use the evidence that's already out there, because there may be something that says, oh, this didn't work quite well, or if we were going to do it again, we would tweak or this was gangbusters. It was wonderful. So take a look, start exploring that literature for what other people have done and how they have answered the need for mental health. It might not turn out to be exactly what you've got in your mind, but it may be a start to that. And it may be something that you can accomplish during the academic time constraints that you have.
Okay. All right. Thank you.
So for Morristown Hamlin, we do have a clinical affiliation agreement with them, which makes things a lot easier to be able to step in and not have a delay there. And we've worked with Miss Lisa. She's been for the nursing administration program, that she's been a preceptor, I think, for at least twice. I can count off the top of my head for it. So I think that those are all great. So one thing to be thinking about is it's going to be good, and it may turn out to be a bit difficult. That when you are doing a project at your place of employment, is people will want to support you, but then sometimes they're scared that their information that they share may be shared elsewhere. So sometimes you may find that some of those statistical information may not be. So you'll be thinking about, how can I take away all of the factors? And I remember doing it for my own self, for people that I worked with, taking away even gender, because I did it with faculty, and we know that our male population and faculty can be often scooped into a handful. And then you could easily point. So you'll be just something to think about for your own self, as you'll be thinking about, how can I get these measurements, and how can I do it the best way without sharing any kind of information to direct them to an individual. I even took away degree, because even when you think about who's got a doctorate, how much can I narrow it down? Who doesn't have this? What are their certificates? How much can I narrow it down? So you'll be thinking about, even though all this stuff, you'll be thinking, oh, it would be great to apply it here and there, but then you'll have to keep it in your back of your mind. Any questions you got for me or Dr. Cameron? Because it sounds like you've worked with her a good amount already.
I don't think so at this point. Okay.
Well, we're here for you. And our affiliation agreement with Covenant is is for a good period of time, and we don't have those break periods. The only thing that Covenant requires is the orientation, which you're probably very familiar with. But even as an employee, they still require you to complete it. And it doesn't take very long because you may have already completed it before for other programs. So it's not anything that delays you enormous time. But as a reminder, if you are ever pulling up any information in the system, you will want to have student access. You want to make sure that you're not using it under your employee access. And sometimes students can get confused on that, and we just don't want you to make any errors and then someone say, well, why were you in here and you weren't working? So you want to make sure that you have a student access. If for some reason you need anything from computer systems, which you very well may not, but you may need something like such as emailing or something like that.
Yeah.
All right.
And I'm actually not employed by Covenant any longer. I teach at Water State, but
Awesome.
yeah, so
it makes it a little bit much easier when it comes to that. Yeah. I think that the part is that sometimes when we have, like, you may have a working lunch that you do and you may be working on school and then not realize what you're logged in under or something.
Okay.
So,
thank you
for sharing.
Thank you.
Okay. Was Ashley, I think that was the name.
Yes. So I'm still trying to figure out which avenue I want to go, because I'm a family nurse practitioner, but I'm also an assistant professor now. So I still do clinical side as an NP, but then I'm teaching. So I'm trying to determine which route I want to go. I have a couple ideas. So I work at MTSU.
Okay.
And we are trying to implement a new like student mentor program where we kind of take maybe like first semester and third semester and pair them up to make them all more successful. So we're trying to really kind of start something new that we haven't really done. We piloted a little bit this past semester, but I'm kind of wanting to take that on and really develop it since we don't have it.
Okay.
So that's one side. I also had thought about doing kind of implementing a like resiliency type training into our kind of curriculum, but maybe even more if it's more centered on like the SNA or something like that. And it'd be more optional. And if I were doing a PhD, I would do it through their entire, first through fifth semesters, but I'm not. So trying to implement that. But both of those ideas are kind of at MTSU.
Yes.
The other is more on my clinical side.
Okay.
I don't know if you're familiar with Murfreesboro Medical Clinic. They're kind of big right now. We just got cyber attacked. It's a whole situation.
Oh, no.
It's been tough. But so they are the other side that I work as an NP with. And something I emergency medicine was kind of my RN background. I really love that world.
Yes.
And we have a walk-in clinic. And so one of my ideas there was implementing like a almost like a fast track triage system in our walk-in clinic to reduce wait times, improve patient care, all the different things there. And it's something that I've worked a lot in our walk-in clinic, and I feel it would be very beneficial. So that's my other kind of idea. I just don't really know which direction I want to go.
Okay.
And I know it probably also matters about the, affiliation agreements and what I'm allowed to do.
Yes.
I think they would allow me to do that at MMC. But that's kind of where I'm at. I'm not real set in stone of where I think I should take it. And I haven't done the research yet to really look and see, where the most data is, about if that's even been implemented in a walk-in clinic type setting,
Well, Dr. Cameron, if you are on, can you tell me, can they do a project measuring students? Because I've heard of trouble with that in the past of not being able to use the student population, or anybody on here that knows that they can use.
You have to be very careful. It all depends on how you word it.
Yes.
In your Form 129, which goes to IRB, because IRB is all about human protection.
Yes.
And making sure that we're not doing anything that's going to possibly harm. And a source, of course, when we're talking students, then part of that is we don't want any kind of labels put on them about they participated, they didn't participate, you know, and how that affects their grade and blah, 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 blah. So you have to be really, really careful. At the same time, when you submit to IRB, we really want you in the D&P program, because we're all about change and policy and those kind of things, is support letters from where you're implementing that says this is a mandatory change process that we are requiring, mandatory, requiring, you know, those kind of words, that says we're going to implement this and that Ashley is going to help us do that. That kind of letter. And that helps as long as we can show that it is a quality improvement project. At the same time, you want to ensure that, especially since you're a faculty there, that you are removed from names and any kind of identifiers. So you would need somebody else to collect the outcomes data so that you're not seeing that Susie or John student who you're then going to have next semester and influence how you think, but all of that is kept away from you. And so we've been successful with doing that kind of thing. But you know, it's all part of 6801 and identifying your project and starting to figure out what exactly your question is and what exactly you want your outcomes to be, that you want to look at. And then in 6802, you are developing and going into all the nitty-gritty details of how you make that happen. You know, step one, I do this. Step two, I do that. And that is also where you submit to IRB to make sure. And Shannon, that really goes for you too, because that privacy thing is ever so important. And there's got to be that anonymity for folks.
And so
it all depends on the wording, but
yes,
something could probably be done.
Yeah, I just know that for student population, it can be difficult to, and you might, I think that, Ashley, I think both populations, both ideas that you have, you're going to be able to find a lot of, information on it. They're both popular. They're both used. That you may not find, you know, as much in certain locations, such as if you're applying it, you know, outside of the emergency room, but you're applying it in that acute care setting. So I think you're going to be able to find lots of information. So I looked up to see, do we have a clinical affiliation agreement with Middle Tennessee State University? And we do, but it expires next month. So it would be a renewal. And I've been told that the renewals and original affiliation agreements are no different of time length. So if you were thinking this is where I want to go with, we can get that renewal process started. You just send me an email, and even if you're not going to use it, I imagine that MTSU would probably be open to having their agreement extended, because we have nursing education students and nursing administration students that may be using those sites in the future, and they'd probably be very much open to extending. So you can just, if you are thinking, you know, if you're still like 50-50 by the end of this day, just shoot me the information and say, you know, I'm still thinking about this site, and we can get it at least started. Because I'll be really honest, I wouldn't be surprised, you know, if we're 3 months in and we get it finalized. It's just because so many hands that need to exchange. But I think that you're going to be able to find a lot of information on both, and so I think they're both great ideas. It's just, you know, you'll have time to sort it out, but they're both good. The clinic itself, usually those are not so hard to get the clinical affiliation agreements with, unless they're very large and it needs to go through multiple hands. If there's 1 or 2 clinics, it doesn't seem to be as difficult to get because it's not this big organization that, the office manager gets it originally. They're like, who does this go with? And then they got to sort out that information. So, no, that shouldn't be as difficult. We should be able to process that in the normal amount of time. Usually on average, an affiliation agreement with a site that doesn't have to go through legal, on average, usually takes about 4 to 6 weeks. I cannot tell you I haven't seen one turn around in one day, because I have. It's been surprising, but I can say that I have seen it. I usually see that for private clinics, such as a privately owned clinic, and the CEO is the owner, and it gets emailed to that.
They're definitely bigger than they're pretty, and I know everything has to go through legal, because I had submitted something for one of our subspecialty clinics, and it took a while to get everything through legal, especially right now. So I can tell you right now, I mean, they don't even have access to most of their systems right now. It's a really, so I know today it would be nothing that they would even be willing to take on at this exact moment, but 3 months from now would probably be different. But they're really,
if you're still, when you get through this first semester and you're thinking you're leaning more to the clinic than just, you'll just email me and I'll tell you the information I need. It's usually pretty simple. I just give you a little bulletin list of it, and then we get it started. And so if they go through legal, and if anybody's ever dealt with legal in any part of life, they work at their own speed. And we wish we could give them a little push and it would go a little faster, but it just doesn't. It doesn't seem to matter if you're willing to, supply your firstborn. They're like, thanks, but I'm not gonna come back on this time. But so legal can just be, some of the sites turn it right around, but for the most part, they usually take a little bit longer. But if I understand correctly, usually 6801, you're not usually in the clinics or at the site. Usually it's more of coming up with your plan. And so usually we can work in 6801 getting those agreements completed. And then when 6802 comes, usually then students are then going into clinics they're starting to work with those individuals. So that's what I've seen done in the past. And that's usually what seems to be the norm. So
we have to have it. In order to get through 6801, you have to have a clinical affiliation agreement with a site.
Okay. And can it be in the works, Dr. Cameron? It has to be completed?
It needs to be completed.
Okay.
Because I can tell you, we've had students who, the word from the clinical site was, oh, yeah, we love it. And then at the last second, we get a note back saying, nah, we're not going to sign this right now.
Yeah.
It's going to take another 3 months. And that messes you up so badly with the rest of your project till I know as a chairperson, as a chairperson for a committee, I will not make that mistake again.
Okay.
So if you don't have a clinical affiliation agreement by the end of 6801, you don't progress.
Well, luckily that for me is next summer. So
yeah, you've got time.
You do got
to work on this.
Well, and like I said, guys, once you have an idea, once you've got it, you've been just talking to a site behind the scenes, you can get that information to me and we can start it as soon as you want, because those affiliation agreements are typically good for 5 years. It's only not good for 5 years if the site wants something different. And that usually comes very seldomly, but for the most part, they last 5 years. So the sooner you get the information, the better, and we can get it started. And then it can be one less thing to worry about when you are trying to decide where you want. And even if we do multiples, even if you're juggling with 2 sites and you're not too sure, that's okay, because our affiliation agreements are saying that it doesn't require the site to take a student. It doesn't doesn't lock them in to say, oh, they absolutely 100% have to say yes to the student. They always have the option to say yes or no. And that's been a question from sites before, and we let them know, yes, it says that you can take a student, but you always have the option to say no. So even if they signed an agreement and then said no, it wouldn't do them any legal harm or anything like that.
Okay.
Any other questions for us? Know that we're here when you do. If you have any for us, if you need to bounce off ideas, think about sites. We have a good amount of sites that reach out often for projects too. So even if you drop on both of these, you're like, you know what, I don't feel like I want to run with them, you just reach out. And I have many sites, many providers that we work a lot with our alumni and try to keep in contact with them, and for preceptors and projects. And often they're more than willing and want to take in a student for their project. So if you end up, for anybody, if you're tossing around something and then you decide none of them's going to work out, just reach out to me, because I do have a good amount of people that I have on my list.
Okay.
And project sites are not as grabby as clinical sites. A lot of people already got different ideas and whatnot. So that list usually stays, not so populated with students. So if you're thinking about something, we have some too.
Thank you.
All right. Anybody else on here that want to chit chat about their sites, what they're thinking about?
Hey, can you all hear me?
Yes. Good morning.
Oh, good. I got my microphone working finally. I didn't get to do an introduction because my microphone wasn't working, so I'll be very quick.
Yes.
My name's TJ. I have background in exercise science and physical therapy.
Awesome.
Then I went to school for nursing, graduated from ETSU, and last weekend graduated with my Psych NP Masters.
Congratulations.
Thank you. So I'm very excited to start the doctorate program. My interest for the project, something I'm very interested in, is the role of inflammation and nutrition in the role of mental health and substance use disorder.
Yeah.
So I've kind of been tossing around some ideas. I got accepted for the substance use disorder residency program for the Psych NP,
Yeah.
which starts in July at Mountain City, and it goes for 1 year.
Awesome.
So I'm hoping that's where I can do my project.
Yes.
The 2 ideas I'm throwing around, one would be to take, evidence-based research about diet and nutrition and implement that, and maybe using some depression screenings or substance use screenings to evaluate the effects of nutrition on outcomes, or implementing like a substance use risk assessment for people maybe that are not actively in substance abuse and maybe have a history, or doing like a risk assessment and then implementing early interventions. I know we only have a short time to like implement our project.
Yeah.
So I'm just kind of throwing both of those ideas around.
Yeah. I think that they're both very interesting ideas. And if the Mountain City, that's with our ETSU clinics, is that correct? I just wanted to make sure. And so we have, because they're with ETSU, there's only one site that I know of that requires an affiliation agreement, and it's just because they're owned by, it's just some weird ownership type thing for that, we don't have to have clinical affiliation agreements because they are owned by ETSU. And I actually think that we may even still have one for that particular site, but I would have to look it up, but I'm pretty sure we do. But so one of the things I was thinking of, and this is just a thought, is that for the risk identification, what have you thought at all about the VA?
As we were just talking about that, and you were saying there are different options out there. I did a clinical a few semesters ago at the VA.
Yeah.
And for some reason that popped in my head. Yeah.
And it pops in my head because, I'm a veteran, but my husband's a veteran, and he's a veteran that's retired. And it's been this long thing. When he was in the military, narcotics was given out like candy. I mean, even when I was in, it was easily given out. And he got out in 2015. It was still, they're being given out very quickly. And luckily, we were really lucky for him, and he just took them as he needed. But we know that injuries occur, and we know this is a big population. And unfortunately, it's not as it's not being as monitored as maybe our outside clinics are. Some of our non-military clinics are ran. It's being run by he's received, you're receiving your prescriptions by your medic clinic. And we were both in special forces. I was attached for support. I don't want anybody to think that I'm really gung-ho. I am really good at killing flies, and that is about it. So it's just a gene. I can kill flies like no other. But so it was just run by our clinics. And so many individuals, that we knew are exiting and into a VA outpatient clinic that's not being run by soldiers. And they're having a hard time controlling their pain. It's not what they've received in the past. It's really hard for some of those alternatives. And they now have pain clinics that they are referring these individuals to, even for some simpler medications, or even if they're only taking Tylenol and ibuprofen, they're still referring them to pain clinics. So maybe something that, if you're seeing for the health clinic, if it doesn't seem to have the population when you're doing your internship there, if it doesn't seem to, I think you said it was a residency program, excuse me. And if it doesn't quite seem to be what matches up to your needs, that may be an option. We work very closely with the Mountain Home Medical Center. And so we have some good amount of contacts there. And I know that they are very interested in having our students. I know that Dr. Haddad's been working with them to see how we can get more students in there. So it may just be something that, in the back burner if it comes up. We also have an adjunct faculty that started last semester that is a provider there. And so that's another open door that may be a resource there to be part of. And I believe that they work with palliative and hospice. So that may be just something, but just some ideas bouncing off if those ones do not work out. But I think that the clinic where you are, I think it's going to be a great idea to be able to assess. And then if you find out that it's not what you need, then we can talk about it further of some other spots for it. But we do have a good amount of clinics around us in Johnson City that we work with. And we've worked closely with the Creekside. We've been working a lot with Frontier, and Frontier even has a lot of telehealth that they've been offering to us. So some options outside. So if it doesn't, the wonderful thing about mental health is that it's so underserved, but man, is it blowing up, and we're getting some people out there, and people are talking, and people are recognizing, and I feel like people are open to some new, unique ideas. And so I think it's very much needed. Any questions? Know I'm here if you need anything. If you think about, if you need different clinic ideas, if all of them fall through, we can come up with something different as well.
Thank you.
I can't see everybody on here. So anybody else left? Anybody? I'm not sure how many students we have. Is this just all of us right here? I'm trying to see. I think that's all. Is that all our
I
students?
think it is, at least right now. One of the students is working today.
Okay.
So she is, when she doesn't have a patient, she's popping in and popping out. So we may have that, but on my screen, it looks like this is everybody at the moment.
I thought so too. I was looking through the names and I'm like, these are the ones I recognize as students, and then outside of faculty and staff. Anybody have any questions for us related to your projects? You got some great brains here. We are available via email or telephone. You just reach out to us with what you need. Is there anything that Dr. Cameron, Dr. Armstrong, that you think that we should touch on when it comes to projects?
No, I was just going to mention duplication. If you find a study that you really like and if you can do a duplication, that adds to the validity of our literature that we're producing. And it's excellent for that, but it's also, you'll know what your problems were, and you can still be able to use that and perhaps join together with the researchers on the other and do a presentation, do a article, get it published. But repeating definitely adds validation to it, right, Dr. Cameron?
Absolutely, absolutely. And you know, one of the things about being a DNP is that looking at the evidence, looking at the literature and seeing what others have done, evaluating those projects or those things to see if were done to a quality. But it also requires the assessment of your place. You have to assess your place to say, well, yeah, that would work here, or no, that wouldn't work here, or I could modify it. So it may be a straight 100% replication, or it may be taking what they did and then making some tweaks and modifications so that it matches your particular needs at your particular place. So yeah.
I think those are all great things. And then keep in mind when you're finding measuring tools is to you try to find one that's free. You can really spend some time and money not trying to create your own or paying money or trying to reach out. Some of them are very easy to be able to email, and they return the email giving you permission, and you get that permission letter, and you have that. And so there's many that are free and then an excellent, that have validation behind it. So,
and use to your greatest advantage the title of student. As a student, we can ask anything we want, right? And people are a little more giving sometimes to students because we've all been there, done that, and they see that need. And so sometimes that can work to your benefit.